Thank you, Kathy. I'll use my outdoor voice. You know, it seems like just a few years, we knew we'd have to replace the MRI when we were on a single site, and it just happened so fast. We were amazed, but the opportunity has come along for us to participate in a group purchasing initiative, and it all just worked out just beautifully. So this is just going to be wonderful for Bluewater Health and for the community for many reasons. So good afternoon and welcome to our preview event for the MRI. As I said, we are very thrilled that it is installed and almost ready for use. We anticipate that its first patient scan should be done in about 10 days. The new MRI is located this time right here in the new diagnostic imaging area, which will make it easier for patients, make it easier for staff, it'll make it easier all the way around for moving patients through the department and make the service much more efficient and friendly. We anticipate that there will be over 9,000 scans in this first year after we start it up and get it up and running. And that is about 2,000 more than last year. Last year we did about 7,700. So that means we'll be helping many more patients with this new piece of equipment. But the most important part of having this state-of-the-art equipment is what it will mean for patients and our staff and our community. The new MRI will allow us to improve on our already leading MRI wait times. We're one of the leading hospitals in the province in terms of MRI wait times. This will provide us with the means to provide a much wider number of tests as well. Certain tests that we currently don't do, we'll be able to do on our machine. So patients who are currently having to leave our community to have these tests done will be able to have them done. The two of those mean that we'll be able to reduce anxiety for patients with injuries and or health conditions in our communities and get that test done sooner and be able to do more of those tests. Less travel time, less expense for patients. Our new MRI will be more comfortable, it's safer, and much more efficient. It's larger and it has a removable table. And it completes the scan much more quickly, all of which are beneficial, particularly to those people with special needs. Faster scans are not only better for each patient, but they also result in the capacity to complete more scans and to be able to meet the increasing demands in our community. The new MRI shows great promise as we seek to live our mission. We create exemplary healthcare experiences for our patients every time. We're so very proud to be able to have this MRI for our residents of Sarnia-Lambton so that they can receive more timely care and much more care and a much higher quality care in our community. I want to thank all of you for the continued support of Bluewater Health and the Bluewater Health Foundation. As we continue to raise funds for this MRI, we have the MRI in place, and it should be in place for a bit of time before it's fully paid for. So thank you for coming today, and thank you for your continued support of our services.
Thank you, Sue, and thank you so much again for being here. I'd now like to introduce Dr. Dougal, who is the Medical Director of Diagnostic Imaging, and we're also very honored that he is the honorary chair of our MRI campaign.
Thank you, Kathy. So, frankly, this the new MRI. We're very excited to have it here, of course, and all the radiologists have been peeking into the door and taking a look as it's been brought in and slowly being put together. And we're excited about, like Sue said, starting our scans pretty soon, within 10 days, we're hoping. And the new MRI that we're getting here is it's a Siemens model. It's called the Magnetome Era. And like Sue mentioned, there's some exams that we can do here that we can't do on our old scanner. And one of those, for example, is the breast MRI. So breast MRI is a whole different area, and it's part of breast imaging. And currently we have the breast assessment program, as many of you know, and we started that last year. It's been very successful here. And to sort of complete the package, we're adding this breast MRI now, and that's a big component of it as well. In fact, the Ontario Breast Screening Program had actually expanded their program to include younger patients who are in the range of like 30 to 69 years of age who have a genetic predisposition to some of these cancers. And in order to be part of that program, you have to have a breast MRI program. So currently, if those patients are in Sarnia Lambton, they're going either to London, or they're going to Windsor, or they're going to Chatham. So we'll be able to offer that and actually have a more complete breast assessment program, in the fact that we can offer all the imaging here rather than patients waiting to complete their imaging going elsewhere. And as Sue mentioned, we do have some of the best wait times here in the province. So you can imagine that a lot of specialists will wait to get the full range of exams completed before they can actually see the patients. So if we're able to complete all those examinations in a fairly rapid amount of time, then those patients get seen by the additional specialists faster as well. Additional things that this new MRI can do, there's some neurologic examinations that are currently done in London, and we kind of looked into it, and we discussed with the neuroradiologist in London as well about doing some of those here. And with the old scanner, we actually were not able to do them because the protocols could not be matched on the old system. And it's a matter of the software, but it's also a matter of the hardware that had to be upgraded. And with this new scanner, we're actually able to do those patients here as well. And again, if they're seeing a specialist here or elsewhere, those imaging, if that gets done faster, they get to see those specialists a lot faster as well. Other scans that we'll also be able to do would also involve pediatric scans. So we currently do some imaging on children, but it depends on the child if they're actually able to stay still for these exams. You can imagine the younger they get, the more difficult it is. With this scanner, it's a lot faster, like Sue mentioned, and so those patients, the younger kids, of course, they don't have to stay still for quite as long. And also there's software improvements that actually correct for motion. So you can have a patient sort of moving their head around while in the MRI machine, and they'll actually correct it so you don't even notice the movement at all when we're looking at the images. So that's a big step forward as well. And it's really good for the children if they're getting a scan, because often it will require sedation as an additional step. And if we can avoid that sedation, of course, that makes everyone more comfortable, including the parents. Fundraising for the new MRI is crucial, as I'm sure you all understand. The government does not give grants for this kind of purchase, and we really rely on the community to come forward and help us out with this purchase that has to come through the hospital and our community. We are thankful to the Sarnia Construction Association that has made a very generous donation and has taken a leadership role in this contribution. We are reaching out to the community and asking you to support the fundraising efforts of the foundation as well. So thank you all for being here, and I'll be around to answer any questions that you have later, and please enjoy the tours.
Thank you. And Dr. Dougal mentioned the generosity of the Sarnia Construction Association, and we are honored to have members of the association here to talk about their gift to this campaign, but also they've been very generous supporters, as has our entire community, of this hospital and a lot of the equipment we've purchased in the last several years. So I'm excited to ask Ray Kern to come up and say a few words on behalf of the association.
Thank you very much, everybody, and welcome everybody here this afternoon. This very, very important occasion. We have a great hospital here in Sarnia, and I checked it out myself for 5 days. So I can tell you everything's in great shape. It's a wonderful institution, and I was treated like a king up here. But I'm privileged today on behalf of Sarnia Construction Association to salute the hospital for what they're doing and how this new MRI is going to make us state-of-the-art in this field, and we're very proud to have it. I want to thank also, though, the people that make it possible for us to make a contribution such as we have done. And that is the major industries we work for in Sarnia, which includes all the major petrochemical industries where most of our contractors work. And of course, not the least, and very important to all of us, is the building trades, the unionized building trades that we work with. They're the people that make it possible for us to have the finances to be able to contribute to such a cause as this. Ross Tias is here today with the Pipe Fitters Union. And that we all of us work together, unusually, like most other places don't have quite the unity we do have We have that going for us. It's a great community we live in. We now have a great hospital, and I'm proud of all the people that work here. And I tell you, at the time I was surveying you for 5 days, you couldn't have done a better job. So thank you very much.
We're glad you enjoyed your stay. Thank you again, all of you, for coming, and I would like to just echo the fact that this community, we are blessed to live in Sarnia-Lambton. It's such a generous community. Without the members of our community, this hospital would not be here. The state-of-the-art equipment that we have would not be here and would not be continuing to come. And we all do it for patient care, and we are really blessed to be here together today. We do have some goodies and some treats down the hallway over here. What we're going to do is, I mentioned earlier, I have wonderful board members that are here acting as tour guides. If you kind of wave your arms at everybody, they'll be taking groups of about 5 or 6 down to the MRI suite, and Dr. Dougal and Marilyn Williams, both of whom have been instrumental in getting all of this organized, are going to be there to answer any questions. Although I feel very well versed in MRIs, they are the experts now, so we'll pass it on to them. And I'd also like to acknowledge the foundation staff who truly made today happen, and thank you to all of them and to everyone for coming. So feel free to make yourself your way down this hallway for some goodies, and we'll get started on the tours, and thank you so much again for coming.